You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, big topic, no more dentures, according to my first guest. He says you could get a fixed set of teeth in just a few appointments. He's an expert on the topic. He's a board-certified oral surgeon, Dr. Akers. Dr. Akers, welcome to the program. Thanks a lot. So it's oral and maxillofacial surgeon. I got that right? So now we had you on the program years ago.
Yes.
So glad to have you back. Now for people that don't know you, know your practice or what an oral surgeon does, before we get into dental implants, and I know you brought a lot of photos, tell me what your typical day is like. What are the procedures you do?
We operate with 4 doctors, and we have a full scope oral and maxillofacial surgery practice. Full scope means that we do facial trauma, we do cancer surgery, we do cosmetic surgery such as facelifts and eyelid surgery.
That's your associate does that?
Yes, my associate does that.
Okay, okay.
And we also do a great deal of dental implants, temporomandibular joint surgery, we do cleft lip and palate surgery, and we do all areas of oral and maxillofacial surgery.
Is that right? So most of your patients come from where?
Most of my patients come from referrals from other dentists. However, we do get a fair number of patients from the general public. We have seminars on dental implants and cosmetic surgery, and we get a lot of patients from those seminars.
So when I start the show and I say no more dentures, do you think that's the future of dentistry, that dentures as we know them today may all be secured by something like an implant?
Absolutely. The dental implant is the finest restoration that's ever come along in dentistry, and it can replace the old-fashioned dentures, the dentures that move around in your mouth, that click, that make noise, that don't function well at all.
Now, in knowing you're coming on the program, I do a Google search. There's about 20 million people have an upper or lower denture. So there's got to be thousands in your town.
There's thousands of people that have this.
But if it's so good, I always wonder that if it's so good, dental implants for denture wear is so good, why is everybody doing it? What's your take on that?
People that have dentures have gone through a long course of dental treatment, failed dental treatment, and the last thing they want to do is come back to the dentist and get their dentures stabilized. They're afraid of the cost. They think that you have to do 1 implant for each individual tooth, but we don't have to do that anymore.
You say just 2 implants?
Yes, with 2 implants we can stabilize the lower denture, and it is a beautiful thing. It gives them a great function. It's very simple to do.
What about pain, though? Now, when you do your public seminars, right?
Yes.
Pain, does that come up? Because it seems very painful.
Pain comes up all the time. And the first time I ever did a set of implants, I gave the patient an extremely strong narcotic. And he came back a week later and he threw me the bottle of pills and said, "Why'd you give me these pills?" And I said, "Well, I thought you were going to hurt," because I didn't know. I'd never done implants before.
Interesting.
And most people say the same thing, that having an implant placed is far easier than having a tooth taken out.
Okay. Now, it doesn't cost more to go to a specialist. Is that true? I mean, it doesn't cost more to go to an oral surgeon or a general dentist?
No, it does not. In fact, in a lot of cases, the general dentists that do oral surgery work charge more than we do.
You know, and for people just tuning in, we're talking about no more dentures, get a fixed set of teeth in just a few appointments with us. We have an oral surgeon, Dr. Akers. But people need to know this is a real interview. I mean,
yes,
that I'm not siding with you here, but people will visit our website, wellnesshour.com, and say, I want a referral. And we don't have a referral site.
Right.
But I always say the same thing, no matter what it is, go to a specialist. Go to somebody that this is their specialty. And so one of the nice things, oral surgeon, is...
I strongly believe in specialization.
You're a surgeon.
I'm a dual specialist. I'm a pediatric dentist as well as an oral maxillofacial surgeon. And so I obviously believe in specialization. I think that when you split the responsibility, I think you get a better result in the long run. I mean, besides that, that's all I do. I take care of people with surgery all day long. I don't do anything else.
Let's begin with how things have changed. Why is it what used to take you guys 9 months to do dental implants, to get it going, now can happen in just a few visits? What's happened?
Before, the surface on the implants was different, and it required more time for them to bond to the bone. Okay. Now the surface has changed, and with the change in the surface, the bonding occurs much faster.
Okay, so the bone grabbing onto it.
It grabs onto it.
All right. What else has changed?
I think that imaging has changed in a huge amount. We are able now in a 3D format able to tell how big your jaw is, where important structures are, and how dense your bone is. And all those things make for a much better result. Another thing that has changed is that we're able to do more restorative work with less implants. It used to be we do 6 to 8 implants for a fixed bridge. Now we can do it with 4 implants.
When you say a fixed bridge, that's a whole arch of teeth.
That's an
Is that
entire
right?
arch
Like
of teeth.
Four
Yes.
implants?
Yes.
Permanent. I mean,
Permanent.
Is that right?
Yes. It's amazing. They're so strong. We didn't know how strong they were, and the design is improved over the years as well. And they can tolerate huge amounts of stress. They're very strong tools for us.
And now, the age range of the people that are coming in for dental implants these days. What is
We
that?
see people from all age groups. We see young people that have accidents. They fall off their bike, they knock out their front tooth. In the old days, we used to re-implant that tooth. Nowadays, we don't do that anymore. We put an implant in the slot because it works far better for the long run. On the other hand, I've treated people over 100.
Wait, so you've given dental implants to people over 100? I'm only laughing.
I did. I had a lady that was 100 years old. She was embarrassed because she couldn't go downstairs and play bridge with her other friends, and she just wouldn't do it. But if I could stabilize her lower teeth with dental implants, then she could go back to playing bridge.
Did it hurt her? Was it painful for somebody that old?
It didn't bother her at all. She was a ball of fire. And
at 80, the bone will grab onto these implants?
No, 100.
100, I
She
mean?
was 100, yes.
Were you a little nervous? You got to admit you were a little nervous.
I was a little nervous, yes. But she turned out great.
Did you question her and say, are you sure you want to do this?
Well, her daughter came in with her.
Okay.
And her daughter was real reluctant and, a little worried about doing this. And the patient finally said, this is my life, this is what I want to do, so let's do it. She was very matter of fact.
So now she can eat and chew? And
she can eat and chew, and more importantly, she can go downstairs and play bridge with her friends.
Is this one of those things that when you do this, that they say, I should have done this years ago?
Oh yeah, absolutely. They think, if I knew this was so easy, I would have done it years ago.
But they're afraid, right?
They're terrified.
Because it seems painful. I mean, it really does seem painful.
It seems painful. I thought it was going to be painful, but it doesn't turn out to be painful. It's much less invasive than taking a tooth out.
Now, by the way, you come from, I guess you have family members.
Yes, I do.
That are dentists?
My daughter's a dentist, yes.
Is that right?
Yeah.
You say with dental implants you're changing people's lives. How so?
Most people don't realize how important this is. If you were to see a patient that walked down the street,
all right,
and she looked like this.
Interesting.
What would you think? You would think she's
sad.
She's sad.
Yeah.
She's tired. She really doesn't
looks angry.
She doesn't think that much of herself. Underneath all this, you're going to find out that this is really an attractive woman.
Her after photo. Okay.
Her after photo is impressive.
So what was going on with her?
She was a single mom. She wanted to get out in the workforce. She wanted to do something to make herself better. And she felt like that her mouth was the focal point of so much of her problems. Her teeth were beyond repair. They had just gone so long, she'd gone so long without seeing a dentist, and they had to go. This woman's approximately 45 years old, and she had no place to go as far as dentistry was concerned. All of her teeth were unrestorable, and she decided to come in and give implants a chance. She needed this so that she could go out in the world and improve her life.
Are there 40-year-olds with dentures wearing dentures? I mean, that's way too young to be wearing dentures.
It is way too young, but any age is too young to be wearing dentures.
Okay. So what'd you do for her? Okay, so all of her teeth have to go.
All of her teeth have to go. We gave her 4 implants in her upper jaw and 2 implants in her lower jaw, and then we had a prosthesis made. Now there's what she looks like now.
That is incredible, side by side. Doesn't even look like the same person. That's beautiful teeth.
She had a few other procedures done to go with it, but people, once they start doing the implants, they start thinking, well, maybe I can do some more things to themselves.
Take care of their skin, their hair.
How you present yourself to the world, it's kind of addictive. Once you start getting a little feedback, then you start saying, well, I'll take this to another level. And
right.
frequently people do that.
All right, you know, now it's very interesting. I mean, you said it yourself. You said if you saw this woman on the before walking down the street, and we'll put these side by side, and then you saw the second, or if this was a job interview.
Right.
Same background, same education.
So who would you hire?
That's right. Good point. And the teeth look very natural, by the way, like cosmetic veneers or something.
These, the restorative dentist who did this work has a natural curved following her lip. You know, you have to find the right person to restore that to make it really look the best that it can.
So, you know, when I originally said, you know, you say you're changing people's lives, I said it in a way where, you know, come on. But
right.
That's life-changing. It's got to be.
Well, that's what a lot of people think of dentistry. They think it's just fix a tooth and that's it. It's way more than that. It changes this person's personality, the way she looks at the world, and the way she functions as well. She's able to chew, she's able to articulate well. It makes a gigantic difference in her life.
Now, you said in the green room over there that of all areas of what you do as an oral surgeon,
right,
that you like the dental implant patients the most, or it's the most rewarding. I'm paraphrasing you a little bit.
Yes.
Why?
To me, first of all, implants are so highly successful that the implants that we put in are going to work at 97 to 99% of the time. No other implant in medicine is that good.
No other surgery. No other
surgery. Strictly from my point of view, from a surgery point of view. But what's really nice is that you're giving them something back. You're taking somebody that has nothing and you're building them up so that they really have something. And, you know, your mouth is the focal point of your face.
Okay.
Without that, you don't
well,
have
you know,
anything.
I always say going into this that you're an oral surgeon, you're a dentist, of course you think the smile's important.
Right.
So you have more photos.
Yes, I do.
Equally as dramatic, you say.
This patient really didn't want to give us a full face photograph. So this is all we have. But I believe the photograph is self-explanatory.
Oh, that's too bad.
And she came to us because she wanted to better herself. She wanted to get into another field, and you won't believe it. When we get finished, you're going to see what we have done to her. It's a total transformation.
Though.
It's not that unusual, mainly because people that have this type of problem will hide it from you.
Okay.
They don't smile. They lower their face.
Good point.
They don't really try to connect with other people because they're embarrassed by the way they look.
So when you look at this person, like on your evaluation, because you know the teeth have to go, do you think, wow, this is going to be a good one?
Well, I have to admit, sometimes we look at people and we think, well, we're really going to make a difference this time.
All right.
And this is really a pretty girl.
What did you do for her?
You'll see. We did 4 implants in the upper jaw and 2 in the lower, and she had a new set of dentures made.
Let's take a look at this.
Okay.
Oh my goodness, you're right. Beautiful. Beautiful. When you put that side by side, that's a big difference.
It's a huge difference. And I can tell you anecdotally that this woman is now a registered nurse. She has gone back to school. She has succeeded, and she's holding a job in the medical field, something that she always wanted to do but didn't quite feel like she could do it.
So 4 implants on the bottom?
2 on the bottom, 4 on the top.
To snap in, snap out.
Yes.
So no adhesive, anything like that. And nobody's going to know she has these.
No
right?
more. Nobody will know.
Now that again doesn't look like a denture.
It doesn't.
Very nice.
It doesn't.
Very nice.
If you get the right restorative dentist or the laboratory to make this, they can be so real that you cannot tell. I mean, we have another lady right here that.
All right. Okay.
She came to our office.
Let's take a look at that. All right.
Okay. Now she's not afraid to smile, so I know that I'm going to have something good to work with. Because
really?
I want her to smile.
Okay. Are there certain people that they don't even want to smile?
Oh, they
for
won't
you?
smile at all.
Even for you?
Even for me. Even for me.
Is that right? Okay. So what's going on with her when I look at that face?
This lady, once again, all of her teeth were not restorable. And we opted, once again, to place implants in the upper jaw and the lower jaw. And you know, when you do that, not only does it make their teeth look better, but their entire face looks better because it supports your face. The skeleton supports the face.
That's a young person. I mean, she looks pretty young.
This is a young person. You know, when you look at this, you might say that the most important part is the cosmetics, but underneath this, inside the mouth, this patient has undergone a lifetime of pain, of suffering, of infections, which cannot help the remainder of her health. she has had trouble with this since she was probably 12 or even younger.
Okay.
Because this doesn't occur overnight. So if she started at 12 and she's 35, that's a long time to have toothache pain. That's a long time to be harboring infection in your system. You know, it's been shown that people that have periodontal disease have a higher incidence of heart disease. And
Interesting.
It's absolutely proven fact.
So when you remove the teeth, the infection goes away?
The infection goes away.
Okay, so let's take a look at her after.
Okay.
Oh my goodness, doesn't look like the same person. Wow, what a difference. I mean, huge difference there.
You know, it's hard to believe how much improvement she's done. I mean, if you look at just the dental work, you can see the blending of her lips and her teeth with the rest of her face. It makes a huge difference to her.
Very
and
nice.
This lady had a fairly low self-esteem. She didn't know where she wanted to go. She knew she wanted to get a better economic position, and ultimately she became the baker of a big chain of bakery stores in our area.
So it makes her more assertive in life.
Oh, it made her come out of her shell.
Now, even though the typical denture wear patient you see is 60 and 70, but there's younger people too.
Yes.
But so no more dentures. You know, people just tuning in, we're talking about no more dentures. As little as 2 dental implants.
Yes.
Could give them something snap in, snap out, no adhesive. As little as 4 implants on the lower could give them something fixed. I mean, a full arch of teeth.
Yes. We didn't think that we could do that in the old days, but now we know that we can go as little as 4 implants for a full fixed bridge. And that makes the costs go down.
Okay.
It makes the surgery a little less, and it's great because they are so strong. Let me show you another case.
Okay.
This gentleman had a job in the construction industry, and he had to meet the public, and he had had dentures for 3 years, and he was afraid every meeting he went to. He was afraid that his teeth were going to fall out, that they would make noise, that somebody would know that he had
Really? They tell you
false
this?
teeth. They do. They're fearful of that. And he said, I've had enough. I never want to wear adhesive again. I want to move into something more permanent, and I'm ready to try it. Now, his case was the first case of guided surgery that we'd ever done.
What does that mean, guided?
That means surgery that is done in the laboratory on a computer, and you perform the surgery on the computer, and you email it to a laboratory, and they make you a surgical guide so that when you place an implant, you don't have to make an incision at all. And when you place an implant with a surgical guide that's prepared off of a computer, it is extremely accurate.
Okay, I think I've seen that. So it's like a model with holes in it. You
It
just put the
is.
implants right there.
Yes. And we had never done this before. And in fact, we were going to do his upper and lower jaw, and it was the first case that had ever been done in our area.
Okay.
And so I was a little nervous about that, and we put his teeth in. We put in 12 implants, and we put his teeth in an hour and 15 minutes.
That's like a fixed set of teeth. I mean, that's like getting all your teeth back.
A full set of fixed
That's
teeth.
a little graphic, but I think it's a
thi-
beautiful look.
This is, you know, what it looks like.
And those, I mean, those don't come out.
They don't come out. They don't come out. And I told him that I wanted to see him next week, and he said, I can't do that. I have to go to Chicago. I have a meeting, and I'll be gone for 2 weeks.
Yeah.
And I was a little nervous. I just put in 12 implants on somebody, and he left
He's
town.
leaving. Okay.
And he came back 2 weeks later, and he told me that everything went fine. And I said, well, what did you eat while you were gone? He said, well, the first night I went to Morton's Steakhouse and had a steak.
Is that right? Is that a true story?
Yes, that's a true story.
So you could eat steak with these things?
You can. You can.
I mean, they're just as strong as regular teeth, maybe even stronger, maybe?
They're
over
stronger than natural teeth.
time? Wow.
I have an implant.
You do?
I do, and I'm getting ready to have another one placed.
Is that, now, you don't put them in yourself?
If I could, I would, but I can't.
You would. All right. Okay. Time for what? Now you have, what's that last one we're looking at over there?
Okay. This is a similar case. This is a man who came in, and his chief complaint is very, very common. I have had traditional dentistry performed on me for the last 30 years, and all of it's falling apart, and the only way to fix it is to start all over again, and I don't want to start all over
So
again.
he's not smiling very big, but what's going on with this guy?
He is angry that he's...
But I mean, those teeth have to all go?
They all have to go.
Okay.
And we did what was known as teeth in a day, where we removed the teeth.
Teeth in a day?
Teeth in a day. And we replaced the teeth with implants and placed the new prosthesis the same day.
Is that right?
And this is what he looks like.
Very nice. Is that taken the same day by any chance, or another day?
This is about 3 days later.
3 days later? And it looks like natural teeth?
Oh, it looks like natural
What does he
teeth.
say? I mean, when they come back, this teeth in a day, so he could have had dentures
Yes.
or dental implants, okay?
Yes.
So he decided dental implants.
Well, you know, the thing is that people that have never had the denture don't know how bad they are.
Okay.
And the people that get the implants, they come back and they generally have no problems. My post-op visits are very short because they don't have any problems with this.
Do they ever give you cards or anything like that?
Sure.
Like a flowers
Yes,
or
they
cookies?
do.
Or...
Yes, they do. We have some wonderful patients, and we've gotten great feedback.
And I know you have testimonials right here. I mean, I can't really read these on the show, but everybody's saying I could talk, smile, laugh, not worry. I can eat whatever I want. It's just like having my own teeth. And the list goes on and on and on. These are on your website?
Yes.
They are. Now, we're headed just about out of time, but
Sure.
options for dentures. And at the top of the show, we said no more dentures, get a fixed set of teeth in just a few appointments. In some cases, teeth in a day.
Yes.
Right? And oral surgeon, Dr. Akers here. So the options. Give us from the basics to the best thing you could do for people with dentures.
Okay. Probably the most common thing that we do is to put 2 implants in the lower jaw.
Like right here?
Right in the bottom, to fix the denture to the implants so that they don't have to wear adhesive, so that the teeth don't...
So they're pretty snug.
Oh, they're very snug. They're very snug.
All right, so that's a huge improvement for them.
It's a gigantic improvement. Now, there are some people that do not want any movement at all.
Right.
And for them, the next step up is to go with fixed bridge work. And fixed bridge work is the ultimate. It's the best way to go. And it requires a few more implants.
Like what? Like how many?
Normally 4 implants per arch is adequate.
Okay.
And we do these frequently, where we would put the 4 implants in and we put a temporary bridge on it the same day.
Now, when you say temporary bridge, I mean, we're talking about like a denture, but that's locked,
a very
fixed
functional
on top
set of teeth. Yes.
And they look good. They look real. I mean, what you're showing me here, they look real.
They look very real.
I mean, I know a few denture wearers. Do you think that all denture wearers are miserable? I mean, is there such thing as a happy denture wearer?
I think that all denture wearers are miserable, but they don't let it bother them.
Okay.
And I think that they, if you had an opportunity to give them an implant-supported prosthesis, they would never, ever want to go back to where they had a regular old denture.
Really?
Because it's so much better. It's vastly superior to putting adhesive in. And
okay. Now, I said this to you, I think, when we talked, I had you on my show before, that denture wearers have other friends that are denture wearers. Do they refer like when it's all done?
Yes.
Big source of referrals?
Oh, yes. Denture wearers are one of our big sources of referral because they're so happy.
They tell their friends.
They tell their friends, and their friends might not believe it at first. They might be afraid of it, but once they get in there, it's kind of like a snowball. One leads to the other.
And this is a big boost for their self-esteem. You and I were talking about this. People treat them differently. I mean, here's a woman. I got to show this photo again. If you guys could show this photo again, that, you know, they're going to treat a person like this differently. She's going to present better on a job interview.
Absolutely.
She's going to present with more credibility.
When people do things for themselves, when people lose weight.
You lost about 100 pounds,
I
right?
lost a lot of weight, and people respond differently.
Do they really?
Absolutely, differently. And better.
But you feel better about yourself.
Oh, I feel a lot better. Maybe I'm acting different. That may be part of it, too.
Yeah, okay.
And maybe she is acting different. Maybe she's approaching people. Maybe she's more willing to get in front of people than she was before. But like we said before, once they get their teeth fixed, then maybe I want to fix my face. Maybe I want to do eyelid surgery. Maybe I need a little bit more chin. You know, they do these things, and it goes
like they reinvent
hand in
themselves.
hand. They're reinventing themselves. And that's the real wonder of it all. That's the best part of it.
All right, okay, final message. Somebody watching this, they're a denture wearer.
Yeah.
They're afraid of pain. They're afraid they're too old, whatever, okay? What do you tell them? Where do they start?
Well, every month I have a seminar, and that question is asked every single month. And people say, oh, it's too much trouble to get this done, and it's too expensive, and it takes too much time to do this, and there's too much pain. Well, first of all, we know the pain's not there.
Not an issue.
It's not an issue.
They don't complain about it, because we have to be careful with
They
disclaimers
don't
here.
complain about it.
Okay.
They don't complain about it. The time involved has been greatly reduced with the new types of implants that we have.
Teeth in a day, you say, in certain cases.
It makes a huge difference in time. Then, you know, it's just, it's such a wonderful thing to commit yourself to doing something. And once you commit yourself to it and you take it on, it's great. Now, if you were missing 3 fingers on your hand and somebody said, I could put 3 fingers on there,
yeah.
wouldn't you do it?
Yeah,
of course you'd do it.
You would think so, yeah.
So if you're missing 20 teeth.
But these denture wearers are just afraid of the dentist.
They're afraid of the dentist. That may be all it is.
So thousands of people in your town, you know, tens of thousands in Florida have dentures, and they don't realize their options because they don't go to the dentist anymore.
They don't. They're not aware.
So no more dentures.
So many cases, yes. No more.
Get a fixed set of teeth. What do you like most about what you do, by the way?
I like it when we can take somebody who has virtually nothing and build them up to where they can go out and work in the world in a functional manner. I mean, the look on their face, you can tell it. You know, it's really a nice thing. I'm lucky to do what I do.
Okay, good. I want to thank you for coming to the show. Very interesting.
Thank you.
Great info. Always a pleasure. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, you could go to our website at wellnesshour.com and put in Dr. Akers. You could put in Florida dental implants. You'll find them there. For now, I wish you good health.